Hey, this is Adil. I'm one of the creators of Table Rounds, and I'm excited to share with you episode 3 of Voices of Table Rounds, our audio-based project that showcases creativity and learning in medicine through collaboration. Let's see what we can teach each other about the connections between cirrhosis and hemoglobin.
Hi, my name is Trevor Wesley. I'm a first-year medical student at SUNY Downstate Medical School. My connection between cirrhosis and hemoglobin is portal hypertension. Hepatic cirrhosis can lead to portal hypertension, which can cause an increase in retrograde pressure and shunting of our blood into our portal systemic anastomoses. One anastomosis in particular can lead to esophageal varices, which can leak or rupture to cause GI bleeding. Anemia can result, and this is characterized by low hemoglobin on a CBC.
Hi, my name is Ashish Sethi, and I'm an interventional radiologist in Richmond, Virginia. My connection between hemoglobin and cirrhosis is portal hypertension, as these patients can present with bleeding esophageal varices. We use minimally invasive techniques to safely create a new shunt, aka a TIPS, from the portal vein to the hepatic vein, allowing for reduction in portal pressures in cirrhosis, and thus controlling a patient's decreasing hemoglobin because of their variceal bleeding.
Hi, my name is Kiara, a fourth-year medical student from Peru, and this is my connection about cirrhosis and hemoglobin. Patients with liver diseases, especially alcoholic cirrhosis, can have structural and metabolic changes in the erythrocyte membrane, resulting in reduced membrane flexibility and finally irreversible changes in cell shape and hemolysis, in this case, low hemoglobin.
Hello everyone, my name is Gabriel and I'm a medical student in the Peruvian University of Cayetano Heredia in Lima, Peru. And my connection between cirrhosis and hemoglobin is that Wilson disease is characterized by the building up of copper within the liver and red blood cells, which predisposes to cirrhosis and hemolytic anemia, and therefore low hemoglobin.
Hi, I'm Fatima, a medical graduate from Pakistan, currently pursuing the LMCC in Canada. My connection between cirrhosis and hemoglobin is liver cirrhosis leading to an increase in the risk of bleeding and so decreasing hemoglobin. This is due to a decrease in the production of coagulation factors by the liver and at the same time due to thrombocytopenia, which is caused by increased sequestration of platelets in the spleen and a decrease in the production of thrombopoietin by the liver.
Hello, Kirtan here. I am a final year medical student from BJ Medical College, Ahmedabad, India. So my connection is between hemoglobin and cirrhosis. So alcohol is one of the leading causes of cirrhosis in industrialized nations. And talking about alcohol can also cause Zeus syndrome, which is associated with hemolytic anemia, acanthocytes on the blood smear, hyperlipoproteinemia, elevated unconjugated hyperbilirubin levels. So yeah, that's it. Alcohol causing alcoholic hepatitis, Zeus syndrome and cirrhosis.
Hello. My name is Muhammad Al-Ashwal. I am a senior medical student at Al Faisal University, applying in September to adult neurology residency. And here is my connection between cirrhosis and hemoglobin. Patients with liver cirrhosis due to alcohol use disorder are at a higher risk of having folate deficiency due to poor dietary intake, impaired intestinal absorption, and increased urinary excretion. Folate deficiency can then lead to megaloblastic anemia and subsequently low hemoglobin levels.
My name is Karine and I am a fourth-year medical student in Albany, New York. My connection between cirrhosis and hemoglobin is through hepatitis C. Chronic hepatitis C infection is a common cause of cirrhosis. Hepatitis C is also associated with cryoglobulinemia, which causes endothelial damage and end organ damage, including glomerulonephritis. Glomerulonephritis presents with red blood cells and hemoglobin in the urine.
As you can see, there's so many different connections that can be created from the same two cards. And even if you come up with the same concepts as someone else, there's nuances in what you end up learning. If you can think of other ways to connect cirrhosis and hemoglobin, we'd love to hear from you. Thank you for listening and stay tuned for the next episode.